So today we're just going to be continuing with chapter 13, which is specific phobia, but we are also going to be now looking at treatments. Okay, so we haven't yet started on evidence-based interventions for specific phobia, so we're essentially officially beginning this topic today. So far we've looked at the different contributing factors that essentially contribute towards the development of specific phobia, but we haven't looked at, okay, how can people now manage their specific phobia? What kind of treatments are there available? And you have to be careful with the word treatment, because in the study design, they're not actually referred to as treatments, they're actually referred to as evidence-based interventions, because there is evidence to back up the fact that these treatments that we're going through actually do work. Okay, they're based on evidence, they're based on many clinical trials with patients who have specific phobia. And there is enough evidence to suggest that these methods or strategies do work successfully in managing specific phobia symptoms. Okay, so in questions where we ask you to talk about these treatment methods or strategies, we could refer to them as evidence-based interventions, or we could refer to them as treatments. However, because I really want to get you guys into the habit of understanding the terminology that VCAR use in their study design, we will almost always refer to them as evidence-based interventions. Okay, so today we're only going to go through the biological evidence-based interventions, which is basically our interventions or treatments for specific phobia that try to address some bodily function or some kind of bodily aspect. So we're talking about maybe affecting the neurotransmitters in your brain, or affecting the actual body in terms of relieving anxiety symptoms by inducing a sense of physical relaxation, something related to the body that either directly works as a treatment by directly impacting either the body or the brain. Okay, so that's what physiological or biological means, something relating to the body or relating to the brain. And so the two treatments that we're going to go through today, or I would say the three treatments we're going through today, are the use of benzodiazepine agents, which are GABA agonists. And before you get a heart attack looking at that word, don't worry, it's not as hard as it looks. And then relaxation techniques. And under relaxation techniques, we've got two types. We've got breathing retraining, which is when you control your breathing, you retrain your breathing to be more calm rather than very frantic and panicked, and exercise. And we've looked at exercise in chapter 3 as well when we did stress. So it's just the same topic again, but this time we're linking it to how exercise can actually reduce not just stress, but also anxiety. And we know that anxiety is a key symptom experienced by people who have specific phobia. So by addressing the anxiety that these patients experience, we can also address some elements of their specific phobia. Okay, so that's essentially the two topics, or the three main biological evidence-based interventions that we're going through today. So let's look at the first one. The first one might be seen as the confusing one. Okay, so remember that when we talked about specific phobia, and we talked about what kind of a neurotransmitter imbalance people with specific phobia have, we mentioned that generally people with specific phobia overthink a lot. Remember, we talked about how they overthink, and there's a lot of neural firing happening in their brain with reference to their phobic stimulus. So every time they see a spider, those neural connections, those neurons continue to connect with each other. LTP continues to occur for these thoughts related to the phobic stimulus, like, oh my God, there's a spider. Oh my God, it's going to crawl on my skin. Oh my God, it's going to bite me. Oh my God, I'm going to die. All of these messages continuously get sent again and again and again. And what that means is that there is a lot of glutamate in the person's brain. Whoever has specific phobia, generally there tends to be an overly excessive presence of glutamate, which we know is an excitatory neurotransmitter involved in LTP, involved in the sending of messages. What tends to happen though, at the same time as there being too much glutamate, is that the amount of GABA is actually less. Okay, and when GABA is less, GABA is the one that's supposed to control these excessive neural firing. It's the one that's supposed to stop. Remember, we said GABA is the red traffic light. It puts a stop to neural communication. In the case of people with specific phobia, GABA does not exist in a good amount there. It doesn't exist in an amount that is healthy, or in an amount that can control that excessive neural firing that's brought on by the overthinking. Okay, so essentially what happens is people with specific phobias need to take medications that will increase the amount of GABA in their brain, or at least, if not increase GABA by acting like the real thing, they need to pretend to act like GABA in the brain. So they need to try to have the same function as GABA. And when any medication imitates the function of GABA, by actually preventing neural communication at the synaptic level, by actually putting a stop to that excessive neural firing, that medication will automatically be considered a GABA agonist. Okay, what the word agonist means is something that imitates or stimulates the activity of something else. So if you give me a medicine that's not actually Panadol, but has some kind of a mix of other chemicals or other substances in it that will essentially act as a pain relief for my brain, even though what you're giving me isn't actually Panadol, it is a Panadol agonist or a paracetamol agonist, because it's imitating the actual activity of how Panadol, the real Panadol, would have acted in my brain. So it's the same thing with the use of GABA agonists. GABA agonists are medications that don't actually contain GABA always, but they stimulate and imitate the activity of GABA, okay? And so the brain can't really tell the difference. The brain just thinks, okay, GABA is GABA, and it essentially will help to control the overly active neural communication that we see in the brains of people with specific phobia. So one example of a medication or a drug that is a type of GABA agonist is benzodiazepines. And I don't know, I feel like benzodiazepines are, they are quite popular in movie references and song references. They're often referred to as benzos in a lot of songs. Okay, benzodiazepines are just any kind of drug that calms the nervous system, okay? Because it calms the nervous system because it acts as GABA, okay, essentially. So when GABA is in your nervous system, there is less neural communication, less firing of neurons. So your neurons start to calm themselves down, and that essentially gives your body a calming effect. Your central nervous system starts to become calm and relaxed, okay? And that's why benzodiazepines, sorry, I'll call it the correct word, benzodiazepines are, can be addictive for some people because they do bring on that calming effect, and that can be addictive for some. Okay, so GABA agonists, an example of that is benzodiazepines, and benzodiazepines act like GABA at the site of the postsynaptic neuron, and they can reduce the symptoms of anxiety by decreasing that excessive neural firing. By putting a stop to or reducing the intensity of that neural firing, they're able to essentially reduce that frantic activity of the neurons between the pre and the postsynaptic neurons, which is what we see in specific phobia patients. Now, in patients who have very mild phobias that are not as extreme, GABA levels can actually be increased naturally as well. And so how can we increase GABA levels naturally? Or if you're the kind of person who might overthink, who might feel like your brain is always switched on and you can never calm down, and you don't have specific phobia, how can you increase the levels of GABA in your brain, okay? Because we know that, you don't have specific phobia to begin with, but you still want to increase the levels of GABA in your brain naturally. So what GABA would then do would be that GABA would help to reduce that anxiety or that frantic neural firing that we usually see in people with specific phobia. Now, as a person who doesn't have specific phobia, you can drink green tea. Green tea actually has certain compounds in it that can actually convert to GABA in the brain. Eating certain types of foods like beans, seafood, all that kind of stuff can actually also help. And these are just ways in which we can actually improve our mental health through diet, okay? And a lot of the time we don't think that our diet makes a big difference. We think that we always have to medicate, but your diet can actually make a very big difference in your not only physical health, but also mental health. And we'll look at this a little bit more in chapter 14 when we talk about foods that you can have to actually maintain mental health. So essentially, these are some examples of foods that will increase GABA naturally in the brain. And people who have specific phobias are often asked to actually increase their consumption of these foods and reduce their consumption of foods that are not good for the brain. So foods like processed foods, foods that are high in sugar, that kind of stuff. Now, there are also, you would have already noticed this picture of this little tub of tablets, okay? And it says GABA on the front. This is actually a supplement. So in the same way you can buy vitamin C supplements, people with GABA deficiencies, regardless of what disease or condition they have, can actually buy GABA supplements as well. Now, obviously, depending on how how effective these medications or these supplements will be for a person is dependent on their own body structure, their own response to the medication, because everyone responds to different medication differently. But these are just starting points that are less extreme. Both of these methods are less extreme than turning to benzodiazepines. Benzodiazepines, sorry, I didn't answer that question before, but benzodiazepines are a depressant drug, correct? It's good that you're making those links. Benzodiazepines are a type of depressant drug, and that's why they help to calm the nervous system down and bring on a calming effect. And if you've ever looked at someone who's got a specific phobia, they are the furthest thing from being calm. They're completely panicked, completely hyperventilating, completely frantic. So benzodiazepines really help them to bring on the calming effect for their condition. Okay, so that's essentially what the use of GABA agonists mean. So that was essentially the first biological evidence-based treatment that we're looking at. And just remember, I'm just repeating it again, GABA agonists mean an agonist is something that imitates or stimulates the activity of something else, okay? So GABA agonists are basically, benzodiazepines are basically GABA wannabes, okay? They want to be like GABA and they want to act like GABA, and then the brain will essentially not tell the difference and think that that's actually GABA and help to calm down the condition of the person with the specific phobia. Cool, so that's the use of GABA agonists, and the example of that is benzodiazepine. So you've got to remember those words, GABA agonist, benzodiazepine, and then understand what benzodiazepines do for people who have specific phobia. And it's all bolded here in the second dot point here. That's very important for you to know. All right, so what are some limitations of GABA agonists? So we're going to go through each of the limitations of these treatments as well. So the main limitation of GABA agonists is that, as with any other drug that you take, any prescription drug, any medication that a person takes, obviously benzodiazepines do have side effects as well, okay? Some people who take benzodiazepines can become very dizzy. They can experience physical fatigue and physical weakness. Sometimes, especially with people who are older, who have been taking it for some time, muscle coordination becomes an issue as well, okay? We don't see this in younger users, so people who are young who take benzodiazepines are not affected as much, but people who have been using maybe benzodiazepines for, the past 20, 30, 40 years of their life, they will generally experience issues with muscle coordination. And we have to remember, guys, that benzodiazepines are not just used by people who have specific phobia. They're also used by people who have depression. They're also used by people who have anxiety disorders, okay? It's not just a specific medication only meant for people with phobia. So benzodiazepines can be used for other mental disorders as well. Okay, now as benzodiazepines are a drug, patients can become dependent on them, like I said before. Some patients can become addicted to them. They can feel like, if I don't take my benzos today, I'm going to not feel calm. I'm going to feel like I'm going to go back to my old ways of how I used to feel. And so a lot of the time you become so dependent on how good that medication makes you feel that you essentially become addicted to it, just as you would become addicted to any other drug. Okay, and as all of you would know what withdrawal is when you give up a drug that you're dependent on and your body's way of essentially responding to the absence of that medication. Okay, finally, obviously everything is difficult to take if you're pregnant or if you're trying to become pregnant. So essentially benzodiazepines are drugs that cannot be taken by pregnant women or by anyone who's trying to become pregnant, because it could harm the baby and could harm the mother in that stage. So the number of groups or the number of people who can actually benefit from benzodiazepines or from GABA agonists as a medication in general are actually limited. Okay, not everyone can use these medications to their heart's content. There are only certain groups that can actually benefit from them, and pregnant women are one example of a group that cannot. So if you're a pregnant woman and you've got a phobia of spiders, well, you just have to find some other treatment method, because benzos are not going to work for you. Okay, so that's essentially limitations. So just know, you don't need to know all of these limitations. I would say just know at least one limitation from this slide. Okay, any one that it's easiest for you to remember, just remember that one. Okay, and then the last thing that we're doing for today is looking at how do relaxation techniques help to help people with specific phobias to manage their symptoms better, and essentially make specific phobia, the experience of specific phobia less intense for those people. So when we're talking about relaxation techniques, we're talking about how can these people better manage their specific phobia. And I'm really using the word manage or address rather than the word cure, because specific phobias are very complex, okay? The way that they develop, as we learned about in the last class, is usually through some traumatic event. And in order to deal with the specific phobia, the person has to deal with the trauma that underlies that specific phobia, that underlies the initial development of the specific phobia. And specific phobias aren't just like a common cold or, you know, you've sprained your muscle. They're a mental disorder. And mental disorders in general, we never really say that we can cure something. We say that we can manage it. We say that we can address the symptoms. But to say that we can cure something completely is being a little bit overconfident. We know that people who have depression, who have been cured of depression, as they might say, can relapse. They can go back into depression. They can go back into specific phobias in the same way. Okay, so essentially that is what that's what we try to say when we talk about evidence-based interventions, that they don't actually cure diseases, but they can help us to manage those better. Okay, so relaxation techniques. So the first one is breathing retraining. And oh my God, this SpongeBob is literally distracting me so much. Okay, breathing retraining. So patients with specific phobia may show characteristic breathing patterns. So they might start to hyperventilate a lot. And you would know what hyperventilation is. Even before you did specific phobia, you knew what this meant. Okay, hyperventilating is when you're doing what SpongeBob is doing here, but your head's not inflating that much, I would hope. You're essentially breathing in a very quick pattern. You can barely control yourself. You feel like you're about to fall. You feel like you're about to faint. That's how rapid and irregular your breathing is. Now, if you've ever experienced hyperventilation yourself, you would know that when you hyperventilate, you tend to become more stressed, okay? That experience of hyperventilating, that experience of rapidly breathing actually makes you feel more stressed and more anxious than you already were. And that makes you feel like you're getting closer and closer to actually having a full-blown panic attack or having a full-blown anxiety attack. So what breathing retraining tries to do is breathing retraining is a way of you retraining your breathing, okay? Exactly what the name suggests. It's an intervention or a treatment method that attempts to try to correct the breathing patterns that specific phobia patients show. So to take them from breathing like how SpongeBob is breathing here, very rapidly, very irregularly, to a more calm and relaxed form of breathing. And by achieving that kind of calm and relaxed form of breathing, the specific phobia patient is able to reduce their anxiety symptoms as well. So how are you going to breathe in a calm and relaxed way? Well, essentially they say that you've got to inhale through your nose and exhale through your mouth in a regular pattern. People who hyperventilate tend to breathe from their mouth a lot, and that actually increases the chances of the hyperventilating kind of breathing happening. Okay, so when you're inhaling through the nose and just exhaling through the mouth and just continuing that regular pattern in a regular speed, that is actually going to help you to become more calm and induce a sense of calm and relaxation for your body as well. Okay, now there's some other stuff on the right-hand side of this page on this picture. So how does breathing retraining work? So you use your nose. The nose is the focus, not breathing through the mouth. You're breathing from your diaphragm. So rather than breathing from your stomach, you're actually breathing from your diaphragm. And your breathing is regular. Your breathing depth is not too deep, not too shallow. It's kind of just the right depth. And your speed is also not too rapid or not too frantic, but just at a speed that is comfortable, and that brings you a sense of calm. Again, that obviously would change depending on who you are and depending on your normal breathing pattern. So what's the limitation of breathing retraining? Well, the main limitation is that breathing is something so automatic for us, okay? We don't even think about how we breathe. We don't think about how we blink, okay? We don't think about the patterns of how many times we blink in a minute or how much we breathe in a minute, okay? That's just something we don't think about. So imagine how difficult it would be to change something that has been so automatic for a person as breathing, okay? Especially if you're a specific phobia patient, that way of breathing suddenly becomes your norm. That becomes the normal for you. So you having to go back and change that, it's going to require a lot of effort and it's going to require a lot of patience. And some specific phobia patients, and just generally people today, we want instant solutions. You know, we don't want to, do something for like 8 or 9 months at a time. We want to do it quickly and we want to basically see the results. So breathing retraining can be time consuming, and the chances of patients giving up without actually, without actually seeing it through, without actually trying their best, trying it for a few months, is going to be very high. So the chances of breathing retraining actually being successful in reducing specific phobia patient symptoms might actually be quite low for this reason. Okay, so that's essentially the limitation, that it is very time consuming and it is very difficult to actually bring on breathing retraining. It's not as easy as, it's easier said than done, essentially, okay? And the last relaxation technique that we're going through today, which looks at, how can we reduce specific phobia symptoms, is this idea of relaxation techniques. So, which is exercise. Okay, and we've learned exercise in chapter 3 when we did stress. Exercise is any planned physical activity. Planned physical activity means that you don't just walk to the canteen or walk up the stairs to your room and say that that's exercise, because that's not planned. That's just a part of your day. Planned exercise is like you set aside 30 minutes or an hour to do some exercise, do some yoga, do some high intensity interval training, something like that, where you're actually, you've planned that out and you've scheduled that out. Okay, and you either do that to promote your physical health or to improve your physical condition. For the purpose of stress and anxiety in this chapter, obviously it can have benefits for your mental health as well. Okay, so generally people who exercise, who have specific phobia, they can work out tension that they build up in the muscles. Okay, when you're experiencing a lot of anxiety from the phobic stimulus and you're always kind of like, stooped over at your desk wondering where the next spider might come from and all that stuff, you tend to put all that tension you have into your muscles. And so by exercising, you're able to work out the tension you've built there. Better endorphins are also released when you are exercising, which can actually help you to boost your mood as well as reduce any pain you have in your body. Neurotransmitters that are associated with good mood and calmness, so things like dopamine, serotonin, all of those neurotransmitters are released during exercise, which can again make the patient feel a little bit more calm if they've got specific phobia. Exercise is a good distractor from the phobic stimulus. So when you're at home just sitting in your bed, sometimes your mind can wander. You can just be thinking about the phobic stimulus all the time. But when you're exercising, you're actually getting out, or you're actually focusing your attention on something else, which distracts you from the actual phobic stimulus. Relaxation can give you a feeling of control and give you the confidence that, you know what, I'm stronger than I think and I can get over this phobic stimulus at some point. And obviously, if you are to be threatened by the phobic stimulus, so you're scared of dogs and you're walking down the street and there's a dog, exercise will actually help you to have enough cardiovascular capacity to run away from the dog, to basically run away from the dog without having to, without collapsing after like a meter of running. Okay, so that's essentially how exercise can help you to deal with mental health and anxiety related symptoms that come with specific phobia. So you don't need to know all of this. Maybe just know 2 ways in which exercise can actually help to reduce the anxiety related symptoms that people with specific phobias actually have. Okay, just any 2 of these. It's very important for you to be able to explain that with reference to phobia. So not just list it down. Don't just write it distracts the person full stop. It distracts the person from their phobic stimulus, okay, which means that they're not paying as much attention to what they're scared of anymore. So you've got to make sure you're being specific and not just listing things down. All right, so that's about it for today. And limitations of exercise. Yeah, so the limitations of exercise is, again, it's really common sense. The main first limitation is that if you are morbidly obese or you've got some kind of issues with movement, you're confined to a wheelchair, it is going to be more difficult for you to exercise. So if you're a patient with specific phobia who has movement issues, exercising might not be a good evidence-based intervention for you to take. Exercise also, similar to breathing retraining, you've got to keep at it. You can't just exercise one day out of the whole year and say, you know what, why do I still have specific phobia? This is not fair. Like, I actually exercised. You've got to put more effort than that. So again, it is a physical commitment. It is a time-based commitment. Okay, so you've got to keep at it. And people with specific phobias often have low mental states. They're not in the mood to exercise. Like, generally, even though people say exercise makes you feel good, when you're in a crappy mood, or you're just so run down by this specific phobia that you have, and you can't do the things you love with the people that you care about, obviously it's going to lower your motivation to exercise. Okay? And we all know that to exercise, you do need motivation. It's not just something we get up and do. It's not as easy as opening your fridge or opening your pantry and getting food. Okay, it's hard work and you've got to keep at it, obviously. So those are the limitations of exercise. So again, just know at least one limitation of exercise with reference to people who have specific phobias. Okay, it's all about linking it back to the patient who has specific phobia and how these treatments either help or don't help them. Okay, so today, that's about it for today. So I'm just going to stop the recording here.